As you could tell, probably we're trying out some new Zoom technology. So thanks for bearing with us. And I want to thank you all for joining us today for a deeper dive into the panel discussion on social connectedness that took place at our December Regional Council Summit. So some of these faces might look familiar to you. I am Darla Sanical, a regional manager for BBF, and I'm going to lead us through a mindful moment, as BBF often does at our meetings. So I invite you, if you dare, to turn off your screen, or you can just look away from your computer for a moment if that feels comfortable. But please place your feet on the floor and sit up tall. And you're welcome to soften your gaze or close your eyes, like I said. Let's all take a deep belly breath in together. And let it out slowly, nice and long. Allow your shoulder blades to gently draw together behind you. And you're softly opening that heart space in the front of your body. So take another deep breath in. And let it out nice and long. Now I'd like to ask you to rub your hands together, creating a gentle heat. And we'll do that for a count of 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Feel that heat that you've just created. Now I'm going to ask you to interlace your fingers or clasp your palms together, whichever feels most comfortable. And notice, just notice if your hands feel tense or at ease. There's not a wrong answer, just notice. Now give your hands just a gentle squeeze and take another deep breath in and out. It's important to remember to connect back with ourselves during our busy days. And this simple exercise can be done anytime you are feeling tension or just need to center yourself. Finally, let's allow our hands to rest in front of you or on your lap. And I invite you to open your eyes and come back to the Zoom room. Thanks so much for taking part in that simple exercise. I'd like to now ask you to add your name and organization to the chat when you have a moment so that we can record who's here with us. And if you have any questions for our panelists today during the session, please feel free to enter them in the chat and we'll do our best to answer them for you. Thanks so much. I hope you enjoyed today's session.
Thanks, Darla. That was great. Welcome, everyone. My name is Beth Trzanski. I am the Deputy Director at Building Bright Futures and thrilled to be here talking about the importance of social connectedness and the work we are doing in communities. So wonderful to have we have three folks who have been doing some really cool work across our state. And it's awesome to see people making introductions in the chat. Building Bright Futures is intentionally created. It's somewhat of an unusual organizational structure. It's a public-private partnership, and we work to engage voices, family and community voices from across the state to be able to gather information, advise the governor and the legislature and our state agency partners on the well-being of children and families. And the state of things is constantly changing, right? And so we really rely on our regional council network of 12 regional councils across the state who meet regularly, who are supported by our staff of 5 regional managers to be able to come together monthly and say, here's what's great, and here's what's not so great. You know, here are the areas where we feel like there are gaps and needs. And also share some of the cool and innovative things that they're doing. We're asking each other for support. And so I feel like we're talking a little bit of at a meta level, right? We are talking about social connectedness that we are building in communities with children and families and communities. But we are our own community at Building Bright Futures, right? In terms of supporting each other in this work that we do in communities and at the state level. So I feel like it's incredibly important, and glad that you could be here today. So what are ways that we are using connection as a way to create resilience in communities and with families? We have 3 regional council partners who are joining us today um, from across the state to talk about how they're doing this. We have Juliet Emas, the Executive Director of the St. Johnsbury Hub. Hi, Juliet. It's great to have you. Kayla Bapp, a Parent-Child Center Specialist at the Springfield Area Parent-Child Center. Hey, Kayla. And Keegan Albaugh, Executive Director of Dad Guild here in Chittenden County. It's great to see you, Keegan. We had Tanya Kristen from Green Mountain United Way, unfortunately was unable to be here today. So I'm going to start us off, ask our panelists to introduce themselves and share briefly about how your programs uses social connection as a way to create resilience in community. And feel free to share an anecdote or a compelling story or an example so that we get a sense of what that looks like in your world. Juliet, I wonder if you're willing to go first.
Sure, of course. Just interject if I go over the time. I know we've got a great group to hear from, and I'm sure we could all talk at length about this work. But that is, I'm sure, very important to not only the people who are present, but those of us on the panel. So it's great to be here today. My name is Juliet. I work for the St. Johnsbury Community Hub. The St. Johnsbury Community Hub is a really unique community designed and community driven space. So if you think about the rec center or community center model, in the sense that there are multiple things happening, there is a physical space, but more importantly, when it comes to the work that we are doing, we have created an opportunity for community members to practice and model, as well as maybe discover some new and, in some cases, refined ways of engaging and practicing good neighboring. So we are a physical space that does have mobile elements. We travel throughout the Northeast Kingdom, primarily in Caledonia County and in Southern Essex. This particular model really says, hey, network theory, if we can change who and how we engage with people, we can change who and how we engage with people. And the real underlying premise of the work that we're doing is that judgment and assumption can be replaced by experience and connection. We want to encourage community members to practice being good neighbors. And we are a parallel entity to agencies and organizations and local or town governance. We're aspirational and visionary. The relationship piece is at the core. It's the fundamental element. If we can intentionally build trust, we can really adjust and expand these relationships that we have, whether it's neighbor to neighbor or it's service recipient to provider. We're in the proximity business. We want to interface and collide with the continuum of the human experience, right? And this is specifically an opportunity for us to build pathways for community members and for community partners, again, to be good neighbors, to collaborate around community identified issues, and to surface community-driven solutions. And so supporting the ability to extend those practices of skill sharing, of resources, of community gathering, and of holding community conversations around really tough things is really at the heart of what we're doing. We want to model stewardship and create ways for community members such as Anna and Amanda, who were looking for resources to feed the community after the Vermont Everybody Eats program ended, and were able to provide themselves for 3 weeks in partnership with another organization 100 meals over the course of 3 weeks. And because we were able to support that relationship, we now have a grant where we're able to do 100 meals every week for 6 months, right? And so the idea that these community members are contributing in their own ways, in the ways that they want, and we can help follow that thread. We can support and foster these beautiful connections, like Steve, who's a community member who shared his personal story with Vermont Legal Aid, who is looking specifically to promote a policy agenda connected to the intersection of housing and mental health and services and how fraught that system is, right? So being able to amplify that in another way. So those are the kinds of things we're talking about, as well as being a physical space that allows you to come and share your knitting, share your whittling skill, share your musical elements, anything that you have. We're looking for ways to support and demonstrate community well-being and enhance that. I think that answers your question. I hope.
Yes, thanks, Juliet. That's great. Kayla, do you want to go next?
Sure. Hi, everybody. I am Kayla Bapp. I am a PCC specialist at the Springfield Area Parent-Child Center. So we serve the Southern Windsor and Northern Windham counties, which when you hear about it, it seems like a really small amount, but in all reality, we serve really close to over 20 towns. And when you think of the Parent-Child Center, a lot of the times here in Springfield, people just think of us as like a daycare, which yes, we do have a very wonderful childcare center downstairs, but there's so many other things that we do here at the Parent-Child Center. And like we have our Children's Integrated Services team, and we have playgroups and diaper banks and that kind of thing. So as a PCC specialist, my main focus is really coming into the community and how can we bring families together and build bridges with not only families, but also the organizations within our community. So during COVID, one thing that we did for playgroups was we created a virtual playgroup that we had kind of a great, like good attendance. It kind of was hit or miss depending on the month. And then when we returned from COVID, after everything started to open back up, we expanded our playgroup region. So we at first, for 7 years, we had a consecutive Monday morning playgroup that happened here in Springfield every single week. And now we have one on Mondays, Tuesdays, Wednesdays, and Fridays. And in the summer, and then once quarterly, besides just our summer program, we have a traveling playgroup where the main goal was to try to break every barrier that families had. So we travel to different locations around the area, like Billings and Vins and the Grafton Nature Museum. And we, SAPCC, provides admission for all of the families. We provide gas cards for the families, and we provide lunch for every single family member that attends. So we really tried to be able to break every bridge. And we just recently were able to get a van. So we're hoping to be able to offer that as another thing as well. Another group that came to about after COVID was we really focused on social connectedness with dads, a lot like the Dad Guild up there. We created a dads group. It was really, really great. The first summer, the very first one we had like 40 dads out on our playground. And it was amazing. And so we've been doing that for a couple of years. We also have our diaper bank where you can see lots of the diapers are stacked behind me in my office. And with that diaper bank, that has really created so many outside community partners with us. Because I'm sure a lot of you know, we lost the state funding for the diaper bank through the Champlain Valley Diaper Bank. And we've been struggling to try to keep diapers in our center that is enough for our community. And the Lions Club in our area and the Rotary clubs in our areas have all kind of banded together and created diaper drives for us throughout the year that are like, here, like, have some diapers for you. And it's really just brought so much to our organization. We also created a formula bank that families can come and get free formula. And the diaper bank is also a completely free program. So yeah, there is really just, it's constantly feeling like we're adding more and more to our organization. But my favorite thing about probably my position here in all is playgroups. And that is because I get to spend so much time with families and really get to learn like what they need. And like when we found out that the formula shortage was happening, that was found out through playgroups from families that were coming and expressing the desire for help. So it's been able to open up so many things for us. And one of our families, or a couple of our families, are relatively new to our area within the last few years. And they are just families of their own, like their families are in different states. And this past Thanksgiving, a bunch of them got together and did a Friendsgiving together rather than just doing it with their own families. And I was getting tagged on Facebook from the moms that I do know that are friends with them. And they were like, oh my gosh, look at what you're doing. Like these families are doing this together. And it was just amazing. So I hope that was a good.
Yes, that's amazing. Congratulations, Kayla. Keegan, love to hear from you.
Yeah, sure. So my name is Keegan Albaugh. I use he, him pronouns, and I am the executive director at Dad Guild. We're a nonprofit based out of Burlington, but we do some work with dads across the state and hoping to do more. And our work, I would say social connectedness is at the core of our work. We have our approach is we use this multifaceted programming approach to make sure that that there's a range of different options for dads, recognizing that it's going to be, different settings, different interests, different times, different days, different locations. There's a lot of barriers that exist when it comes to, I think getting anyone engaged. And so we provide opportunities for dads to connect just with themselves, dads with kids. We do special events, workshops, campfires, playgroups, meeting at coffee shops, just like all different kinds of things. And we have a network of about 1,000 dads now across the state, which is really great. When I think about particularly social connectedness, I think we've all kind of seen the research now that out of that 80-year study out of Harvard that showed how social connections and the quality of those is like the best predictor of happier, healthier, longer lives. And then on the flip side, we look at, we work at an organization, we work with anyone who identifies as a dad. And so we have a lot of trans dads, we have folks who identify as masculine, and it's not always just like cis hetero men who are participating. That being said, the vast majority of the people we do serve are men. And studies have shown that over like the past 30 years, the number of close friends that men have cut in half from 6 to 3. And in fact, 1 in 5 men reports as having no friends. And then we know that men are half as likely to seek out help and support when they're struggling. And we know that men are committing suicide at a rate 4 times that of women, which men are struggling. And isolation is a big part of this. And then we throw in, this transition into parenthood. We know that 10%, it's a hard number to find, but we know that approximately 10% of new dads experience postpartum depression. We know that from studies that depression increases by 68% in dads over the first 5 years of a kid's life. And we know that approximately 1/3 of dads don't have anyone to talk to about fathering topics after the birth of their child. So you combine all of this stuff around what we know is healthy and what we know is helps us live longer and is much happier. And we have men who are increasingly isolated, and there's some big problems that are coming out of that. And also, new dads are even more isolated. So it creates this really big problem. And then we look at one of our surveys of our organization back in 2021, we surveyed just 40 dads in our community, and 80% of them said they were not connected to any other parenting group or support group or anything fatherhood related outside of Dad Guild. And so we're like, oh my gosh, like men are struggling, dads are isolated, we're not reaching them. It's like, this is a big problem. This is a big problem for dads and their mental health. This is a problem for kids. This is a problem for families. This is a problem for communities. This is a huge issue. And so a big part of our work is creating spaces where men can be empathetic and connect in really positive ways, and creating opportunities that are maybe more engaged with their interests or their passions or where they feel comfortable, really meeting them where they're at. We do a monthly peer support campfire in the woods. We play basketball every Tuesday night. We, trying to find something for everyone just to make those connections. And then as terms of data that we track, it's figuring out, we're learning that, hey, when dads participate, they're increasing the number of social connections they have. Over half of them are connecting with those dads outside of programming hours. And it's really amazing to start seeing, you see the impact. And just like a quick anecdote, we do a new dad cohort. We're just starting our second round. We're just finished our first, it's a 6-month program where dads participate once a month in person. And they're dads who they've had a baby within the past 12 months. And the first group we had went from you walk in and there's 12 new dads and they're all kind of sitting there it's a little awkward. And then by month 6, they're best friends and they're meeting outside and hanging out and playing. And I'm in a part of one of their group texts. And one night I'm sitting there and then this text comes up just from one of the dads saying, just want to let you guys know I really love you. And everyone really responding. And it's the moments like that, I see the impact. And it also gives me a lot of hope for the future and what's possible with the community that we have here in Vermont.
Shivers, Keegan, you got me, gave me shivers. That's amazing. Thank you for sharing that story. That means a lot. So some amazing work to try and build social connection among the children and families that you're working in. And I know that it's not easy, right? So I know that, you may set out with a certain strategy to try and build social connection and then hit some kind of barrier. And would love to hear, anyone can go first. What was that barrier and how did you address it?
I'm happy to go first.
Thanks.
So as I had mentioned, it wasn't last summer, but the summer before, we had created a dad's group here in Springfield. And the first summer, it was incredible. We had a very consistent amount of dads that were coming. We were constantly coming up with different ideas for us to do with them. And it was just a consistent amount of dads that were coming every Thursday. But we lost the facilitator that was our main dad. And now it has just been myself kind of running it. And I am not a dad. I'm not a parent at all. And we just don't have that kind of male presence there to kind of gear the dads in conversation and stuff. I do my best, but there is only so much that I can do. So at the beginning of this year, we created a family advisory council for the entire parent-child center. And we pulled caregivers from every program to this group that they meet quarterly. And we kind of just talk about what do you want from us? What can we do? How can we help you? What are we doing good? What do we need to work on? And one of the first things that came up from the dads that were in the group was our dad's group. And they suggested a lot kind of what Keegan's program is doing is let's do pop-up events of what can we do that interests dads? Some of them we talked about doing a little baseball game where we do a pickup baseball game. We talked about going bowling and all of that. And at our dad's group, we always provide them dinner. And so we talked about just doing maybe we do cookouts and just different things like that. So it's really just kind of, okay, this worked for a little bit, but now it didn't. And now we're adjusting it. So we're hoping that this summer that being able to do these pop-up groups and really gear them more towards activities that they would be willing to do together, either with just their child or with other dads, is really what we're trying to focus on rather than just oh, let's get together on the playground and socialize, because that was just really not working well.
Thank you.
I'm happy to go. One of the things that we recognize that there's always barriers, and you can do as much as you can, and there's always going to be barriers. And so we do the best that we can at our organization. And one of the things that was important to us, like the first kind of like decent sized grant that we got was from the UVM Medical Center, which allowed us to fund our fatherhood peer support network and program relating to that. So our dad's night out, anything that's kind of like dad peer group related. And one of the things that's we really important to us is we don't charge for any of our services and want to make sure that everyone can access it. And we recognize there's still barriers. And so we have an equitable access fund as part of our organization, as one of our line items that we've worked in through the UVM grant that we're a part of. And what that money is for is to make sure that money is that, we'll do the best we can, but like that money is as little of a barrier as possible to participation. So in addition to not charging for our programming, that money could be used to, whether it's paying for a babysitter, paying for childcare, paying for transportation, paying for lost wages from a job if they have to take time off, or if they need any kind of like reliable technology to participate in our virtual offerings, it can be used for that as well. And one time that it was really nice seeing this in action. And it's one of those things that we try to get the word out, and we want people to use the funds more if they need it, because we have it there. And I remember one time someone accessing it, and they used it to come to one of our campfires. And when they got there, this is a single dad, and said they had never had a night away from their kid, who was, I think, 6 or 7 at the time. They had never had a night away, and this was the first time that they could get away, and this was the first time that they had ever had a babysitter. And it was to come and connect with all these dads over like a pretty intimate campfire. And seeing that was just like, oh, this is great. What are the next barriers? And let's start looking at those ones.
I would just add, I think what's really great about these two examples, or well, both of the multiple examples that my colleagues have shared, show how on these on the community level and in the focused framework that we can make some of these shifts possible. And one of the things that is challenging and that we have been focusing on is how do we make that paradigm or larger shift as a practice that community members can put into their toolbox, right? And to help people continue to practice those things individually. So how do you show up? Well, there are community members who have never been invited to show up. There are community members who don't feel that there are spaces that it's safe for them to show up. We practice a human-centered model that says, we want you to show up as the best version of yourself today. And because we're engaging with the continuum of the human experience, right? So you can think about people and even your own experience, right? That there are people across the spectrum of whether it's economics, whether it's transportation access, whether it's trauma, mental health, physical health, cognition, however, single parents, not parents, grandparents, right? We're running the gamut. And so we know that everyone's going to show up differently. And so how do you instill a shift where that's okay, where it's safe to do that? And not only is it safe, that we want you to practice, and we want to give it to other communities that maybe just haven't had time, energy, financial access, whatever it is, to maybe tap into something new and different. And the shift that we're doing is coming at it from that, at least in our case, like this kind of larger macro level, where we're saying, hey, let's do and provide a space. Again, space doesn't have to be physical, right? An opportunity for community members to come and try and show up, right? We're actually just issuing just that basic of an invitation, because our communities have gotten so removed from accepting invitations, also because we live, at least in the Northeast Kingdom, in a very rural area, and people actually can't accept invitations, right? And so 3 things that we do that I think are really key to responding to those barriers is we do and have what we call good neighbor agreements. Community members go in and out of spaces all the time, and it's so inconsistent. People might have signs and positive affirmations posted on the walls, and then you go in and maybe you're met with a cranky receptionist, right? Or your care is our priority, but you feel like you've been leaving messages, right? And so you're not getting the response you need. And so community members said, hey, we can't do this. We need a space at least where we can expect and have the consistency of those expectations being met. So the good neighbor agreements are 5 guidelines for engaging when you engage with the hub. And that includes encouraging safe spaces, being considerate of others, being mindful of the things you bring with you, and being supportive of others, and knowing that community starts with you and it's modeled. And so you carry that through in 2 other ways. And I'm happy to say that one of your colleagues who's on this call was a recipient of one of our pitch contests, right? So how do you give community members the practices and the skills to then go out and then make it and do it? And so the pitch contest, if you think kind of Shark Tank model, right? Hey, what's your community idea? And each time it's been themed. So community members pitch an idea and we actually give you money to go do it. I mean, it's small grants, $500 or $1,000, but that's still something that for communities is huge. And then the last thing that we have is a stewardship program, right? How do you offer a refined opportunity for community members, again, like we said, with limited access, but tremendous interest, or hadn't even known that they could have an interest, right, in showing up as an extension and a steward of good neighboring and all the things that Keegan and Kayla are talking about, so that when there is a gap, they can feel confident in stepping up or trying to engage, right? I think that that's what we're trying to do. And those barriers come really from having to fight against large system changes and community members who are really struggling to even identify that it's possible for those opportunities to be present for them.
Great reflections, Juliet. I certainly can feel how hard it can be to engage, and especially because of COVID, where we had to engage differently, especially via Zoom or virtual, is how to come into community spaces and regain that confidence to be able, and trust in each other to be able to do that, and have some common expectations. That's cool. Darla was asking if you might also talk about building up neighborhoods and community field trips. Can you just say a few things about that? And then we'll get to Courtney's question.
Yeah, so again, because of the framework that the hub has chosen to use, and again, we know, and Keegan talked about this, Kayla's aware of this as well, right? We know that connecting with community, connecting in general matters. We know it changes things, and it can be the one thing. We know that youth, if they have one person, one adult in their life, that can change the trajectory of their development. And we're constantly in this framework where we have to prove that this stuff works. And I'm sure, again, if you're on this call, you could be like myself, quite frustrated with that, right? And so part of what the mobility piece of this is actually going to where people are, right? Whether that means literally going where there's a congregation of people, congregation, again, not faith-based, but like where people are congregating, which means you have to, especially in the Northeast Kingdom, travel. You have to move. You have to go to people, right? Because we know there are so many barriers with access, roads, transportation. I mean, mud season. I mean, you know, if you're from this area, you're aware of this, right? This is not like being in Philadelphia, which is where I'm from originally, where you can get on the subway and go across town. That's like a city that's how many miles in 15, 20 minutes, right? That's just not how it works. And so how do you, instead of making a blanket solution, you design based on the community, which means some community members are going to need you to do small repeated activities. Some communities are going to say, actually come back quarterly, right? Or give us the resources, we'll put on the event, right? And so we create an opportunity to have these community conversations to, again, till the soil, right? We want whatever community idea or connection to grow. And we want that land, soil, whatever to be ready for that. So that includes what we call neighbor up nights. Building up communities in St. Johnsbury. We're working on a specific grant to literally work with neighborhoods in St. Johnsbury to, again, strengthen their neighbor knowing neighbor kind of framework. Organizations and communities have invited us to travel around for different reasons and to do certain themed conversations. We have been invited to go on a prevention roadshow where we're talking about, and it's not us talking about it, it's us helping facilitate the conversation about substance misuse and prevention. And so the framework really is, hey, we want someone to help us host that conversation so that we can then tap into some of these opportunities to build a stronger, better community. And I hope that answered that question. And we are happy to come to you.
Amazing. I love it. So cool. So Courtney had a question in the chat about data and how we measure success. She was talking about, you know, certainly you can gather stories for qualitative data and a little bit more about what quantitative data may be collected. So would love to hear if anyone wants to speak to how do you measure success? What kind of data are you collecting? And even what you do with that might be helpful.
Yeah, I can real quick, in terms of like data collection for us, it has been around social connectedness, has been around like the number of people they feel they can turn to or talk to about things. How many times, like, are they connecting with other program participants outside? And then we also include like, how often are you talking about mental health? And getting some pre and post engagement. We also do an annual survey, but those are like around social connectedness. That's like the primary data that we use, and then highlight, some of the data or some of the research I shared earlier about the problem. So I'm happy if you have more questions. I'm also happy you can email, and I'm happy to like chat. My poor executive functioning brain might just take a little bit to respond.
Yeah, Keegan, can you just say a few more words about the timing of how you collect that information? Sounds like you do a pre and post of at least people, a captive audience, and an annual survey. What's your design for that so that people respond and you get the information you need?
Yeah, for sure. So as we've been around, this month we celebrate 5 years of Dad Guild, which feels like a little bit of time and a long time at the same time. But our data collection process it continues to improve each year. And we use like an online database system that we pay for. And so we have, when people like participate in events, we have like required sign-in ones, and then we can administer a survey. So this like next new dad cohort that's starting up, for example, that starts up in April, that will have like a dozen dads. They can register, and then through that registration, we can send a survey, and then 6 months later can send a post survey to measure and compare that data. And then we also have, so we can do that for each program that folks register in it. We're going to be doing some more workshops that are going to be workshop series and not just individual workshops. So we'll be doing the same practice gathering data there. And oh gosh, my brain just went for a moment on live Zoom recording.
That's okay. We were just talking about like how you're gathering that information.
Oh, yeah.
And then to be able to show that you're making the change that you want to be making.
And then then the annual survey. We do an annual survey every May just to try to gather, and we send that out in our newsletter to all of our program participants. We also have sections for community partners, and we have sections for partners of the dads who are participating in programs, and we generally keep that the same each year. So that we can compare year to year about different trends or whatnot.
Thank you. Yeah, being able to show that we are making a difference in building social connection is not the easiest thing to measure. I don't know if anyone else has a reflection around kind of what data you are choosing to collect and what you're doing with it.
Yeah. So through the Parent-Child Center, there is obviously required data that we are like mandatory have to get, like the number of children in the home, number of adults in the home, town of residence, that kind of stuff. But then we, at all of our events, like our play groups, that kind of thing, we have everybody sign into those. They give us all of that information, and then they sign like in disclosure for social media and that kind of thing. And then twice a year, the Parent-Child Centers send out a PCC survey, which is a survey based on all of our services. And that has like a lot of like generalized information on it. And then a lot like Keegan's, we do post surveys, especially when it comes to our like parent education workshops, so we can figure out what is something that you would like to learn about next, because what's our next steps. And then at our bigger events, like our Week of the Young Child Family Festival, our Duck Run, our Santa's Workshop that we run, we have staff members that go around and ask like a quick 3-question survey. And that is actually how we found out from the community that they needed more access to playgroups. So not only do we have a playgroup almost every single day of the week, just offered through us, they are in different locations. So we have a Springfield one, we have a Ludlow one, we have a Cavendish one, a Windsor one. And then we have a playgroup action team that has a huge list of all of the playgroups that we have in our area. So a lot of it is like not even just physical data, but it's word of mouth and like speaking back and forth with them and kind of relaying in our, not even in our own brain, but within our organization of like, how can we make next steps with this?
Right. You're gathering information all the time about how you can improve what you're providing. That's quality improvement to its best. Keegan, there was a follow-up question in the chat. And Juliet, I don't know if you wanted to answer the data question, but you're welcome to respond in the chat or verbally.
Yeah, I can real quickly address. So I just put it in the chat to Rose, because you were asking about if our organization like helps find them a babysitter or child. Like, so when you say child care provider, I'm assuming like finding a babysitter or someone to watch your child to attend programming. That's not something we actively engage in. We usually refer people. There's a Facebook group that is something like if anyone has. For me, I feel like there's some potential liability issues if our organization is like directing caregivers to babysitters and then something were to happen, what the liability is there. If anyone has work or thoughts around this, I would absolutely love to connect or follow up, because like a vetted babysitter directory, which like seems very easy to make, but I understand there's probably red tape, but like would be high in demand. And then the other one, Sandra, you asked, yes, I worked at the family room, started Dad Guild, and then worked at the family room myself there for about 2.5 years doing fatherhood stuff there while running Dad Guild, and then stepped away. So I'm connected with staff there, and there's some stuff happening.
Thank you.
So thank you, Beth. Keegan, I can tell you about how we do our what we call marketplace, which is at the end of these community conversations that are, again, putting the community into a place where they're the referral, right? Like they're the market, and they're the person who's pitching, so to speak, oh, I had so and so provide care for me, or right, and you're making these connections and the links, right, and matches. And so like we use that as like as a way to kind of like help people make those connections. So I'm happy to tell you about that later if you'd like.
I'd love to hear more. And my experience has been caregivers like treat their babysitters as like precious gems.
Mm-hmm. Well, the
Oh.
other thing is that so that was something that came up here, and then I will respond to the data collection thing, because I do think it's a really interesting one, is that again, this was a pitch contest idea. Somebody won it from the Parent Child Center, actually, from NECA, the capstone agency here. And we trained 10 or 12 youth, like under the age of 18, but over the age of, I think it was, again, you had to be 14 or 16. I'm trying to remember. Certified babysitter Red Cross program, and they helped them make business cards and, you know, set them up, and they actually did babysitting through us for a community-wide event. So there were adults, it was supervisors, people signed off on it. So the community answered by making it possible, right? They found that there was this certification program that you had to pass a test, right? And so that held enough credibility to kind of move in that direction to answer that need, right? So in regards to the data, I think that one of the really fascinating things about that, and again, I'm going to talk really fast, is that it really all depends on what you're looking for. And the best reporters are the individuals themselves, right? And we, again, statistically, we could go through all this, but like, if I rate my whatever experience as a whatever number and it was good, my good is going to remain consistent, right? So you could track me by asking all kinds of questions. My interpretation on the scale is going to stay stable, right? Even if my view of whatever I'm doing changes from good to bad, right? So getting community members to report on anything, right, is going to help you. I think that one of the things that we're trying to shift is, what are we collecting that's actually necessary and useful, right? It's really invasive to ask people about their income. How do they identify demographically, when really they're coming in because they feel it's safe, or they're coming to connect as a parent, whether it's through the Parent Child Center or through Dad Guild, right? Like, and so they're there for other reasons. And so if we can find other creative ways, like we're going to make April data collection month for our food grant, this community meal thing that we do 100 meals every week. So we started off by asking people, how is this meal impacting you? That's it. That's all that we're recording. And then we're going to hit a point, which we did, where we said, okay, these are the 6 common answers. We're going to put up a dot survey. You're going to walk in, or roll in, or fly in, and you're going to be able to walk over, or fly or roll, and put on like a dot on where it applies for you. And then, is there a reason to collect more specific information? Well, yeah, because if we want to show that this is impacting families, right, then we need to be able to ask the right question to show that. If we want to show that we're hitting on the aging population, right? And so when you are upfront with community members about why you're collecting the information, right, they're more apt to participate. The question, though, really is how much of it's really necessary? And part of the shift that we are trying to support is that some of this information is not relevant to us, right? We don't need to know. And it's the reporting for the higher beings that are our funders that care. And so how do we help them see that some of that information maybe needs to shift with the times, right? And it's an ongoing conversation, and there's always the option to abstain, right? And so you build that in, and then you have community members as part of your creators, right? It's not me projecting. It's the community members who are coming in for the meals. What do you think is helpful to share? What do you think you would feel comfortable asking or not answering, right? And getting them to be part of it. So we are actually creating something that is data that the community actually cares about.
We have a question from Amber, who works in early intervention, and she was just reflecting on the super rural nature of a lot of our communities and thinking about how families that she's working with would really benefit from connecting with other families with children with complex medical needs. And that is sometimes hard, both to identify who the other folks are in the community, but then how do you create a safe forum for them to get together? So I don't know if anyone wants to respond to whether it's serving families with that particular challenge, or just like how do you design programs to be able to serve a particular population, especially given how rural we are.
So here at the Parent Child Center, it's just at the beginning of this year, we created a thing called an I Am Me playgroup. And it focused on children with all sorts of abilities. So it's a sensory geared playgroup that is run by two of our CIS members, our CIS nurse, and then one of our CIS speech pathologists. And in that playgroup, it really focuses on children that cannot typically go to a normal playgroup for whatever reason, whether it be medical, sensory, whatnot. And they just contact Deb, our other PCC specialist, but the Wednesday before. It's the last Saturday of every month. And just they answer a couple of questions, like what are some needs that you feel like you need met from your child? How do you feel like we could help you? That kind of thing. And then when the families come to those playgroups, we have a more intense conversation with them there. It's still relatively very new, so we've only had about 4 families show up for it, but we've had really great responses from the community and the community members. So we're still really working. It's still very new. So if anybody has tips on things like that, then I would absolutely love to hear them. But that is something that we are at least trying here.
Thanks, Kayla.
I think it starts with having a place to go, right? Not go physically, right? But like an entity that you could share that idea with, whether it is your neighbor, whether it's your local capstone agency, the Parent Child Center, whether it's the hub, whether it's Dad Guild, right? Like, and so that's where we're at, where we are saying, bring us your idea, and that's why we're also then going out, because we're trying to say, hey, let's go to you, right? Because we know that's an issue, a barrier, and we know we can't take down all the barriers, but we're trying. That if you can surface this, let's start then with creating a space and an opportunity or an invitation to even surface it, right? And again, I go back to this network theory model that we use, but this marketplace where you start then to hear when you bring community members together in these intentional collisions, that's what we call it, you're going to find out that, oh, there's another family member or another community member who's really asking a similar question. And then we want that to make a match, right? And last, I would say, is the definition of success. 4 families, that's great, right? Because that's 4 families that were struggling before and that now have a space to go and who now can start brainstorming and create a network or a resource, support system within themselves, very similar to how Keegan was talking about the dads, right? Or dad group that can surface. So I think that those are the really wonderful, powerful things that we're trying to say are possible, and you have to start at the even more reserved back level of a space for people to convene and gather, right? And that is what community connection is you have to actually be able to foster the connection.
Thank you. We are building connection here. It's amazing to hear what you have to share. I'm going to hand this to Courtney. We are up at time. I feel like we could talk about this a lot longer and already made a lot of connections and shared some great ideas. So thank you, Courtney.
All right, thank you so much. And thank you to our panelists and everybody who was able to attend today. I feel like I could listen to you guys like all day long. So it's great to hear what you're doing. And we want to just point out too that the topic of social connectedness came about through focusing on our regional priorities, especially around child and family mental health, and to hear what is going on throughout the regions and the wonderful work that you all are doing. So thank you so much. And just to remind everyone that the regional priority setting will be going on in May. And if you're not already connected to your regional council, I can put a link in the chat to connect you to that regional council. And we'd love to have, the more voices at the table, the better. So again, thank you so much. And we look forward to future work around social connectedness.
Thanks, Courtney.